Hi guys, this is Aditya,
This is Ekansh.
and today we've got a very special guest with us. The reason why we have him today is because we're going to be talking a bit more about alternative pathways of excellence that you can reach through after your MBBS. The reason why we want to do this today is because I think what from our experiences, what we've realized is that during MBBS time, uh, a lot of people are not really clear as to what are your options beyond the clinical aspects in your post graduation. A lot of people want to explore other options like MBA or other pathways that essentially pharmaceuticals. The purpose of this video is to introduce you to someone who has been there and done that. He's done his MBBS and is doing something different, and that's what we want to introduce. So I leave it to you. Is it Gurpreet? We've got Gurpreet Arora. He's my close friend from MBBS, and he's going to be talking about what he's doing and why he's doing that.
Go for it, Gurpreet.
Yeah, can you guys hear me clearly?
Yep.
Great. Hi everybody. Hi Aditya. Hi Ekansh. My name is Gurpreet Arora, as I've been introduced. So, a bit about myself. I was Aditya's batchmate. I did my MBBS from when I was in the university, and from then I've moved on to work in different fields which are not classically clinical. So I've done a fair bit of clinical work as well, but I've worked across program management, human resources, clinical trials. Around 5 to 6 years of work experience I have post MBBS, and I have explored my way through government hospitals. A lot of my work experience has been with a renowned international NGO. It's called MSF, so Doctors Without Borders. I got the opportunity to work with them in India on a mission in Africa. I worked with COVID on a COVID project with them, and I'm also working on a tuberculosis trial.
So it's obvious, Gurpreet, you've obviously done quite a bit with MSF already. I know, I'm pretty sure I obviously had and still have a dream to work with for the MSF at some point. I think there's a lot of people like me who want to do so. So how did it actually come about? How did you actually get involved with it? What did you have to do? What was your motivation behind it?
So honestly, I think this is a pertinent question where I would like to start for what my thought process was during MBBS and what I went through. And I really later spoke to a lot of people and realized that others have a similar, maybe going through a similar process, but we don't often verbalize that to each other. So a lot of us go into MBBS with a very half-baked idea of what we want to do and where we want to go next, and fantasize medicine in different ways possible. But I think
More
once you're
like no
into that
idea.
so once you're into that grind somewhere midway, I would say second year, third year, whatever, you have that realization that either you're not liking the process, or the
It's getting real.
results or the results when they come, the effort required would just suck you up big time, would just take a lot from you, and maybe you cannot see the result in close light. So that started to happen with me. I started to question what I wanted to do, why I wanted to do. uh, there were few things which were clear. I knew that
Mhm.
I like to fix patients, but I like to fix processes more. uh, so had that bent of management, of fixing processes for any, even during extracurricular events in med school, or even in the hospital, at whatever our level as a as an MBBS student or an intern you could do. If you could fix a small process,
So you're
make a
telling us
flow.
that while you did like the clinical aspect, you also really enjoyed the administrative aspect. Is that correct?
Yes, I did. Yes, I did, because I believed it was impossible to separate the two. A
Okay.
doctor cannot work in isolation. A hospital, a nursing home, a lab, a ultrasound center has to have a full functional machinery, from registration to consultation to laboratory to diagnosis to pharma dispensing to
So
management
you're
of the
curious to
laundry
know how
food.
these things work,
Yes,
how
yes,
the
yes, yes, yes.
processes actually fall in place for a doctor to actually do their work.
Yes. So I was really interested in that because and it does impact. There's a lot of interdependence. Huh? It might not be very obvious to the eye. There's a lot of interdependence and failure of one part. It's like a chemical reaction that
Yeah.
the rate is determined by the slowest step.
No, that's
So
correct, I think, and that's something that Ekansh, you and I have also realized while we've been working with the NHS, that how big admin is an important part of your day-to-day working, which essentially was possibly there back in India as well, but not something that was so much in your face as it is now. And I think that's something that Gurpreet, you've picked up and you've worked on that. So what did you do afterwards?
So at that point of time, it was more of a leap of faith, to be honest. Now that I look at it in hindsight, but I realized that I met really good people. I met some people who could give me the confidence that they had my back. They could guide me through the process. A lot of formal and informal mentors. That is what the discussion we were having before the video. That how mentorship is very important for anyone, especially so for lines which have a very esoteric circle like medicine, where you have a limited amount of information and you can delve into that information so deeply that you might not realize what's going on in the outside world.
Absolutely.
Because there's
So how did
always
you
something
get
to look
into
for.
MSF? What did you have to do to get into the MSF? That's what a lot of people want
So
to know.
so I would not particularly like speak about a particular organization. I would really want to speak about the sector,
Okay.
like the
Yeah.
international not-for-profit sector, or
Hmm.
international humanitarian sector. So that is the word I would use now. So one thing is, I mean, all these international organizations have websites and there are very clear criteria of what they want in a doctor, in a manager, in say an epidemiologist or a nurse, whatever they hire. They hire a lot of non-medical professionals too, but that's beyond the point of this conversation. So you can log on to the website. There are many big organizations like this. You can apply. A lot of them ask for some bit of experience to send you for a mission or for work outside your home country. But usually, if you have to work within your home country, they would still consider freshers or have less experienced people.
So,
Okay.
so
Uh,
Brilliant.
to ask on to that, so you worked in a non-profit organization for an international firm. What drove you to get into that decision, and leave? So that you said you've delved around in a different after your MBBS. So what was that push that sent you to the? Uh,
Yeah, that's a good point to raise. I'll speak about that. So as I said, at that point it was leap of faith, but now that I look, there were steps which combine and there is a process through it. And that's why someone who knows, who's been through the process, will guide you how to get into some any non-conventional field, for the lack of a better term. However,
Hmm.
nowadays it's becoming more and more accepting for people to move into this. I got a lot of pressure from friends and family of why you don't want to do PG, and given the scene for BHU, we had internal reservation and you would get easy PG seats. Uh,
Absolutely. Funny, interesting thing that I want to point out is Gurpreet actually did not sit for the exam, simply for the thought
yes,
process that if I sit for
So you're telling me that was part of the process to not sit for the exam.
it was a
yeah.
bold move. I think I'm sure you must have heard of lots of people telling you that no, this is not the right thing to do, but you stuck to what you wanted to do. That's a very good thing.
So they said that you should sit for the exam and then you may not take the seat later. So I again I think this was a process challenge. Why would you go through a process if you don't want to come to the end point?
True.
I at that point of time I connected with a lot of people. I think this is one suggestion I would give everybody: talk to a lot of people, connect to people who you think have done what you want to do. So that
So
is
where
the
do you
first
find such
step.
kind of people? I mean, I'm just like, for the viewers, it's easy when we say talk to people, but where do we find such people? How do we find the people we want to talk to? Who's the right kind of people?
So I would say 9 to 10 years back that the process was slightly more difficult because the internet was coming up. There were social
Hmm.
media platforms, formal platforms, LinkedIn, discussion groups, but they were not as accessible and usable as they are now. So
Hmm.
nowadays, I think that would be the primary point. Speaking I would say listening to talks like this, looking for a mentor,
Hmm.
finding people on LinkedIn and in your networks. Because if you are a medical student, or even if you're just a medical aspirant, you would always know someone who has done it, and that's how you talk into them, talk to that network. Everyone would more or less certainly know someone who has either done medicine or followed a career which is not classically medicine. So
Hmm.
talk to them, understand their process. There are pros and cons. It's not a rosy affair, just like medicine. It's not all negative. And whoever talks to me about this or getting into even in the international humanitarian not-for-profit sector, it's not all rosy. There are issues, there are good
What
points,
are the
and there are bad
challenges that
points.
you face, Gurpreet? What did you what were some of the hardest things that came about when you got into it actually? Not
So one Yeah. So one was a completely new setup. I was trying to do something which had not been done before in my circle, at least. So there was
Mhm.
no information. You had that initial fear. You had to adjust. A lot of people can do that. A lot of people don't like to do that.
Yeah.
Yeah.
Then later, when I embarked on an international mission, staying away from the family, working with minimal resources, you have to adjust your expectations, because a lot of us are used to working in a setup, for example, where X-ray can be done at the drop of a hat.
Yeah.
That said, there are setups where it is not feasible due to lack of electricity, due to lack of equipment. Blood tests are not so feasible. You have to rely on your clinical acumen. So readjusting your priorities to suit that situation,
Hmm.
I think that was one of the hardest part.
Sure.
Okay. So you essentially had to become flexible with your application of clinical
Yes.
science to the resources and the surrounding that was available. What are the missions that you've been to? Where all have you been to? I know it's a charm and everyone wants to go to some obscure places, and tell us about some of the the nice experiences that you have, some of the good countries you've seen. What's the good experiences you've taken out?
So I'm still at the initial phases of Germany. So I've not, as of now, I have worked in India, a couple of years in India. I worked at a remote place that was a very short project, a remote place in Chhattisgarh, where we had a project. Then I was in a COVID mission in Patna, where we changed an indoor stadium into a 100-bed COVID facility.
Oh
Uh,
wow.
End of 2019, I was in South Sudan, which is a very small country in Mid-Eastern Africa, devoid of resources. That was a very interesting experience. No one mission is like the other, and that's the same with all organizations. It is very context specific based on need. Like working in a tuberculosis missions, where we have very good facilities for laboratory tests. Uh, yeah, and so each mission is different. You grow, you learn, you meet people, you see motivations of different people from around the world. It has been a very enriching experience. And for viewers who are, I believe a lot of us are concerned about monetary returns of it. I've always maintained that all returns cannot be measured in an economic, on a money scale. But if you talk about the economic returns, it's not that you have to do unpaid work. It is a salaried job, and you get salary like any other job, depending on. Hi. So I was saying that I get a lot of questions from aspirants about the monetary aspect of the returns of such work. Though I've maintained that all returns cannot be monetary, there's a lot of intangible that comes with meeting people around the world, doing work in places where people readily need support. But there is a proper salary mechanism for all, not for, at least I can talk about the international sector. There is They all pay salaries. You can argue if they're competitive, non-competitive. Some are more than the others. You can find if the organization matches your individual values. Uh, Talking about how long the missions are, uh, they can be, as depending on what your specialty is. Even surgeons, anesthesiologists go for missions. Doctors go for missions as doctors, as managers, as facility managers.
So you
Uh,
can enter the MSF at any level, say post MBBS or post grad or
so Yes, yes. So I would refer for any or all such international organizations. I would really ask people to go to the website and see what different operations or different projects they have around the world, and
Okay.
then see what is the profile that they are looking for. Even if you don't find an exact match, connect to someone who's working and see how they went, how they found their way. Because even if you don't get into an organization or line of work immediately, I think your job is to know what more is to be done to reach there, and that can be done again through mentorship and talking to people. That is my way. I mean, internet can only give you as much information. It can
Absolutely.
take the first step, but after that you need more support.
No, I agree with you. And one of the most important things I would say is that if you want to go on to a path that is not as conventional as the rest of the people or rest of your peers are going through, it's very important to keep your stand throughout the process. There will be challenges, there will be mental questions whether you're doing the right thing or not. But you have to stick to your ground as long as you're confident that this is something that you want to really do. And another thing that very wise point from Gurpreet, that no, all returns are not monetary. You do have to gain more in terms of experience as well. So I think that's a very key point in deciding what you want to do and do ahead in your careers. And MSF is just one of the different things that you could do. We'll over time we'll be bringing in more people who've been going into different aspects up after their MBBS. I think the most conventional routes we know is either a conventional doctor, either a physician, a surgeon, or maybe an IAS is very common. But professions like where Gurpreet is now doing working for a non-profit international organization, it's something that everybody can think about. It's something that you could always remember that after your MBBS internship, there are options available.
The
So
message is
can I just
basically it's yeah, yeah, go on,
yeah.
Gurpreet. Go on.
So I just wanted to make one more point for you and everybody who would maybe at a certain point see this, that it's okay to take time to explore. A lot of us are really hard on ourselves that if I don't know what I want to do right now, then let's just go ahead with what everyone else is doing. I think everyone has a different clock, everyone has a different cycle. It's okay to take time to explore, reach out to people, use mentors, make those formal and informal connections during this process, because I was also very insecure, unsure during the initial years. So I did a lot of research about doctors who are not doing medicine. And I can ensure you that people who did MBBS are doing everything possible, from businesses to owning hotels, to being musicians, to doing research, to doing pharmaceutical,
You're
to
making
doing
YouTube
consult,
channels.
yeah, to making YouTube channels. Yeah, doing management consulting with big corporates. They did their MBA from the Harvard, Stanfords. A lot of them working into public health, which is, I believe, a more known field. A lot of them working in finance services. So there's a whole lot of pool of your caliber out there. If you're already gotten into MBBS, you already have some level of intellect and say a commitment to work hard, that will already take you places. So just back yourself.
Brilliant. So, in summary, guys, I think what we're just trying to say to everyone who's watching this is there's life out there besides just doing a postgrad. There's lots to do. Life is big. Take time to make mistakes. It's all right. Take time to explore. Life works itself out. It's worked out for all of us. It'll work out for you guys. As what Gurpreet said, take time to network, try and find out, be proactive, look up online, take the initiative and try to find out where your interests lie and what you can possibly do about it. Speak to people, connect, reach out to us. We'll try and help you as much as we can. Find a mentor if you already have one, well and good. If you don't have one, connect with us and we'll try and do that for you. And we'll try and bring you more videos of people who've done the, in your words, the non-conventional stuff and are pretty happy and then they're doing really well. Yeah.
Absolutely. Right now,
So
all you need is a leap of faith at the end of the day.
leap of
Right.
faith. That's true.
Have any
So
more
right
questions?
advice at the right time, as always. Just like to thank Gurpreet so much for taking the time out and sharing his experiences with us. It was a pleasure to have you.
Absolutely.
Thank you, Aditya. Thank you, Ekansh, and anybody watching this. It was a pleasure, and I'll be, uh, I'll be glad if it could make a positive change in your life. As Ekansh and Aditya have said, reach out to people, use mentors if possible, wear a mask, stay hydrated. Thank you.
All right, guys, stay safe. Good night. Bye bye.
Your mentor 121 at gmail.com.
I'm not clear. Can you repeat what?
It's your mentor 121 at gmail.com.
Yeah, that's very
Brilliant.
famous.
Good night, guys. Bye bye.
Good
Cheers.
night. Yeah.